An announcement from the Conservatives yesterday suggests that they're going to move forward. They're making it a campaign promise as well, with what you might call forced treatment for people that are experiencing addiction, for people that have been unable to kick their reliance on drugs. The United Conservatives believe that families or law enforcement, other officials or organizations should have a say in whether or not someone is committed to treatment. This is something that's gleaning a lot of attention, including from our next guest. Professor Benjamin Perrin is a law professor at the University of British Columbia's Peter A. Allard School of Law. He served as a law clerk at the Supreme Court of Canada, and he was lead justice and public safety advisor to former Prime Minister Stephen Harper. He's the author of two previous books, Invisible Chains, Canada's Underground World of Human Trafficking, a national bestseller, and it was named one of the top books of the year by the Globe and Mail. He's also the author of Victim Law, the Law of Victims of Crime in Canada. Professor Perrin joins us from his home in Vancouver, BC. It's nice to see your face again. Thanks for making time for us.
Thanks, Ryan. Great to see you again.
Now, what do you make of this? And this is not officially what they're calling it, but this initiative from the UCP. It's been bandied about for a while, but it was officially introduced yesterday as a campaign promise, what you might call mandatory drug treatment. Is this something that had been considered in Prime Minister Harper's office way back then? Is this purely provincial jurisdiction? Is it something you think could be effective, or is it out to lunch?
Well, this is unfortunately not the first time we've heard this, and it's not the first government who's either floated this idea. It's actually becoming kind of vogue among people who are, quite frankly, just kind of feeling like, can't we just make this whole addiction issue go away? Can't we just lock everyone up who has an addiction, who kind of annoys us or gets in our face? If that is the spirit behind it, I mean, that would be horrifically wrong. I think there's definitely a lot of hatred towards people who use drugs. We know that. The research shows that people who use drugs are the most stigmatized of any group in society, even more than people with leprosy, according to a survey by the World Health Organization. So when we look at this question, we go, well, what's going to help? People are dying in huge numbers, record numbers. There's been an increase in overdose calls even in Alberta recently. And so would forcing someone to go to treatment work? And what would that look like? So let's walk through this, right? So what does forced treatment mean? Well, typically what it's talking about is taking someone and putting them in a place where they cannot have access to these substances they've been using. What the research shows is that forcing someone voluntarily or forcing them to go on cold turkey on opioids is a death sentence for many people. The British Medical Journal found that people in a 28-day detox program who successfully completed that program, meaning they went the whole 28 days without using drugs, were, get a load of this, more likely to die from a drug overdose than people who had not completed the 28-day detox program. Well, why is that? Well, the reason is opioids and people with opioid use disorder, if you slow your use, reduce it, or stop entirely, your tolerance rapidly declines. And so because this is a chronic relapsing condition, that won't surprise anyone to hear that people who have addiction, that this doesn't just stop and it's over usually. Most times it takes many, many years for people who do get into recovery and treatment. And the research shows that forcing people or voluntarily just going cold turkey doesn't work. There's a whole bunch of other concerns with this law. The biggest risk we have right now of people overdosing and dying is using alone. That's what the research shows. People use alone, they're more likely to overdose and die. What this law does is it sends the message to people who use substances that if you tell someone that you're struggling with substance use, that you could be brought before a court and locked up. That is not the message of understanding, compassion, support that people say that they need and benefit from when they make the decision to get into treatment.
I should note that they're calling it the Compassionate Intervention Act, and it would allow, as mentioned in the intro, a family member, a doctor, a psychologist, a police officer to petition a judge to issue a treatment order. Danielle Smith saying yesterday in Calgary that this is part of the United Conservatives' focus on a recovery-oriented system of care. It would come alongside a promise for more than 700 new addiction beds at 11 different treatment centers, including 4 First Nations. I feel like the conversation in Canada, oftentimes, especially when you're talking about funding, when you're talking about the political side of this, it falls into two lanes, generally speaking. You'll have every politician acknowledge publicly that it's a problem because they can't ignore it. It's obvious. Thousands of people are dying in Canada. 2 people are dying in Edmonton every day. The mayor just told us that sitting in this studio last week. So you've got, I think, some people characterized as our plan is to invest in harm reduction, safe supply, which we'll talk about, supervised consumption sites, and the like. Support services, creating the relationship with healthcare workers and going from there. And then you have others, like the United Conservative Plan. Jason Kenney was a big advocate for this as well. The recovery method, so-called detox, investing in opportunities, investing in resources for people that are ready to, get off drugs, to put it casually. Does it have to be a choice between one and the two? Are we oversimplifying how this needs to work? Are both an important pillar of an informed science-based strategy? What do you think?
Yeah, let's start by talking about why people are dying. So you showed the statistics a minute ago from Alberta. We see similar stats in BC. We see Ontario, other provinces. Manitoba, by the way, won't even release their data. I don't know if you knew that, Ryan. They have not even, in the years this has been going on, have not publicly disclosed how many people actually died in the province of Manitoba. So just to flag that and call that out. But what is killing people?
Hey, Ben, hang on a second. Why do you think that is? What's your speculation on that?
You don't want people to know. If there's no body, there's no crime. Okay? It's disgusting and it's wrong. There needs to be public accountability here. And the Premier of Manitoba and her government has refused to tell Manitobans how many people have died in her province from the toxic contaminated drug crisis. And this is a government that has opposed life-saving measures like overdose prevention sites, where the only thing that happens there is if someone who's going to use drugs anyway goes unconscious, that they're given naloxone, an antidote to temporarily reverse the effects of an overdose. They're given air breathing support, and if necessary, transport to a hospital so they don't die. The province opposes those measures, and yet they will not tell us how many people have died.
Okay, so an informed approach does what? Like, people right now in Alberta are looking, there's a significant undecided vote right now, and people are going to be looking at platforms, and they're going to be, for folks for whom this is the election issue or a major election issue, they're going to want to support the party that's funding or committing to an approach that can be effective. Can both approaches be effective? Is one out of tune? Is one more dialed in? I don't know how political you want to get. I know you have an interesting background yourself, your own personal evolution, which you've talked about here on the show. But what are you noting from election platforms in Alberta?
Yeah, I mean, when I did my research for my book Overdose, we went and actually met with folks. I was opposed previously to things like supervised consumption sites. I went and actually saw them. I met people there and I read the research. There are hundreds of peer-reviewed articles supporting overdose prevention sites. They save lives, full stop. So we need to have those. So part of this is we need to keep people alive. That means giving them an emergency response when they are overdosing, because they're not in treatment right now, and it takes many times for people to get into treatment. And so first of all, we need to keep people alive. That means widespread available of naloxone and safe places for people to use. That's the first part of an evidence-based approach to responding to the toxic contaminated drugs that are killing people. Secondly, we need to realize what is killing people. The research shows between 80 to 90% of people who have died of drug toxicity in Canada had fentanyl in their system. I didn't know what fentanyl was. Okay, this is a drug that was created in the 1950s for palliative cancer patients. It's a pain medication. Okay, once the federal government started cracking down on the prescription drug abuse back in the Harper government era, and companies like Purdue said, "Hey, we don't want our products being misused," so they made them harder to crush and inject. Organized crime didn't just pack up their bag and go home. By the way, also cracking down on global heroin. They realized, hey, we can make our own fentanyl. Okay, we can make it in a lab, and it's very easy to make. So that is what is killing people. So it's talking about grains of sand of a highly potent opioid, and it has contaminated the entire drug supply. So if someone was addicted to cocaine, there's fentanyl in it. If someone was addicted to MDMA or ecstasy, there's fentanyl in it. If someone is buying drugs just for a bachelor party, there's a high chance there's fentanyl in it as well. Okay, and we have all these cases that show that. So if that's what's killing people, is drugs that people are using now are contaminated with this substance of, we don't know how much is in it, and again, grains of sand can be enough to kill. We need to replace that substance with a substance that is of known contents and potency, that's what's referred to as a safer supply. So again, it's people are using a toxic contaminated drug anyway, and we need to substitute that with a substance that has known contents and potency. And so that's where we see a big debate now is that a good idea or not? And so we can talk more about that. And that's a huge part. Another piece is treatment and recovery. We need rapid access to evidence-based treatment and recovery. So 2 points. The public health people I spoke with said 2 hours is the window. That's the window you have when someone who has a serious substance use disorder says, I want help, to get them into some sort of rapid access program. Most places in Canada, you cannot do that, not even close to it. And it needs to be evidence-based. So I mentioned before, detox-based alone is not medically recommended. It's dangerous. And so there needs to be things like opioid agonist therapy and that sort of thing. So if you look at what saves lives, the research shows that 60% of overdose deaths were averted in BC because of 3 things alone: widespread availability of naloxone, overdose prevention sites, and opioid agonist treatment. So it's the combination of harm reduction and treatment that saves people's lives.
We did talk about that opioid, that OAT treatment, so to speak, yesterday with columnist Adam Zivo, reporter, journalist for the National Post. We talked about what he describes as his expose, a 10,000-word piece, the headline, Drug Fail, the Liberal Government's Safer Supply, Fueling a New Opioid Crisis. You can see it on my screen here at nationalpost.com, about 10,000 words, which is an unusually deep dive for a paper like that into a contentious issue. Not everybody appreciated the fact that we were even talking to Adam yesterday, and some advocates, in particular harm reduction advocates out of Western Canada, Professor, were talking to us about what they call flawed research. We put it in front of you, and you wanted us to note right out of the gates some of the sources here. So here's a portion of, here's a moment of my conversation yesterday with Adam Zivo.
I was put in contact with a man named Dr. Julian Summers, who is a researcher based out of BC, who had written a review of safer supply literature. And he had concluded that the vast majority of the research in support of safer supply is actually hot air. Essentially, most of the research supporting safer supply are small-scale qualitative studies. So essentially, glorified focus groups with Vancouver-based drug users who have a strong incentive to romanticize the program.
Why is Dr. Julian Summers' name so significant here, Professor?
Yeah, it was really telling, your interview, and I am actually glad that you interviewed him and that you've given, myself, and I understand you have Guy Felicella and some more to talk about. I think it's good to talk about. Let's have the debate in public.
I agree.
The problem is, what you hear from Adam, who I have personally reached out to, is that he got on this kick by reading a report that Dr. Julian Summers wrote. Adam then goes on to say, and you might have the clip coming later, that he then sort of pulled the thread, and everyone he talked to said the same thing. That should be a pretty big red flag if everyone you're interviewing tells you the same thing, right? So that's something called confirmation bias. It's well known in research. It also is a problem in journalism, right? If Adam's a journalist and not an opinion writer, you're supposed to hear both sides. He didn't do that. So this is neither, this National Post article is neither good research, nor is it good journalism. I've asked Adam 2 questions, publicly and privately. And the first is, do you consider this piece, this 10,000-word article in a national newspaper, an opinion piece, because he writes those, or do you consider this a journalism piece? I think that's a fair question, Ryan.
Sure.
He has not answered that question. The other question I asked is he going to correct the record? Because conservative leader Pierre Poilievre says that Adam's National Post op-ed on safer supply is proof that safer supply kills people. Adam never makes that claim. The article does not say that. It does not say that safer supply is killing people, and safer supply is not killing people. And so far, again, Adam has refused to correct the record. His piece has caused a lot of harm. It's also flawed and has a lot of problems. So let's get into that. So to start with, the Julian Summers piece, which was critical of safer supply, was commissioned by the province of Alberta. The UCP government wanted to research it and look into it, and had already come out saying they weren't really all a big fan of it. After a review of existing literature is put together by Dr. Summers and some others at SFU, a group of 50 research scientists, addictions experts, and other people, folks with lived experience, wrote a very critical review of that. They demonstrated that Dr. Summers' review included articles that were not relevant. They weren't part of the study. He missed articles that should have been in there. And when they assessed the research methodology based on standard scientific research methods, they found it was what's described here, got the report right here, as critically low quality. Critically low quality. So that was the start of Adam's introduction to safer supply, and he admitted he doesn't work on this issue, right? He works on Ukraine journalism and LGBTQ issues. So he's new to this issue. He's not been living in Canada apparently for maybe a year or so. He didn't actually go and meet with anyone, go to any of these programs. So when he began to sort of pull the thread, as he said, and everyone would agree with him, he didn't even realize, or even if he did, he didn't talk to any of the 50 people who had problems with Dr. Summers' research. So I get back to the question, is this National Post piece an opinion piece that someone's trying to argue a position from, or is it journalism? I think the evidence is clear. This is someone's opinion. He also makes the claim that there's no evidence of safer supply programs working. That's also not true, and we can get into some of the facts from safer supply projects, not just in BC, but in Toronto, in Ottawa as well.
Here's that clip you were talking about. I just want to present it to the audience. This was Adam Zivo yesterday talking about his sources.
What I can say is that there was a consensus amongst my interviewees that safer supply is not working. Well, I'm very aware that there's another school of thought that disagrees vehemently with that, and you can see that all over my Twitter. Everyone agrees that the opioid crisis is horrific and we need to do something. We need a solution, and what we're doing right now does not work.
There it is.
Wow. Can you believe that? I mean, so in the same breath when he says that every one of his sources agreed that safer supply is working, but that he's aware that there are other voices, and he didn't bother to talk to any of those people. So I think really, I think it's a great service that you brought him on, because he revealed to us that very clearly he did not do his homework, he didn't do his research, and he's on a vendetta. I heard him on your program say he is opposed to safer supply. That's what he said. Look, he is entitled to his opinion, just like you are, just like anyone is. But to put it in a 10,000 word investigative journalism piece, and that's in air quotes, and have it affect people's lives during a public health emergency, and have it picked up by conservative politicians, including Pierre Poilievre, to make statements opposing a life-saving public health intervention is completely irresponsible.
I want to give people an idea of the politicking that's happening around this. We want to note that not everybody has 3 hours a day to watch every bit of news that comes out of Ottawa, plus their own province, plus their own city hall. Here's a tweet from the Conservative Party just a couple of days ago. I believe this was May 11th. Quote, "The Trudeau Liberals are pushing hard drugs on our streets, fueling the opioid crisis and trapping more people in addiction. Get these toxic drugs off our streets and give real hope with recovery and treatment to bring our people home drug-free." And then they reference that piece in the National Post. I know you're not a speechwriter, but you were a policy advisor to a prime minister. How would you counter that messaging in Ottawa? What would be your take on the accurate interpretation of what actually happens with a safer supply initiative?
Well, the only thing we can do when there's misinformation like that, which is really, really dangerous, is to fight back with the facts. I've been busy fact-checking Pierre Poilievre, fact-checking Adam Zivo on social media and interviews like this. Let's get some facts on the table. So some of the claims are people are not using their safer supply. They're just selling. The claim was everyone was selling it to others, and that it's not working. So here's some data. Let's get into the stats here. So this is from a study of the Ottawa Safer Supply Program. 81% of people who were on that Safer Supply Program who had recently overdosed experienced no overdoses while on safer supply. Okay, in Toronto, in the 3 months before people were on safer supply, 50% of them in the program had an overdose. 50%, half. In the 3 months during their time when they were on safer supply, that reduced to 15%. So first off, if we say what is the primary objective of safer supply programs is to save people's lives, the emerging evidence from these pilot projects is that it is. The other claim that we're hearing is that everyone is just, no one's using these substances, they're just giving them to others. That's also false. It's not true. We talk about the issue of diversion, which has been known for years and is something we need to be evaluating, monitoring, and making adaptations to these pilot projects to make sure that we get it right. But just to be clear, people are making use of the safer supply in choosing it in greater proportions than they were the toxic contaminated street drugs, the criminal drugs that is what Pierre Poilievre has as the only source for people if he's opposing this. So again, from the pilots in Toronto, we see a 78% of people in safer supply were using fentanyl daily. That's that toxic contaminated street substance I mentioned earlier. while on Safer Supply, that went down to 31%. So people are using their Safer Supply in these programs. And we see similar results from places like Ottawa. Listen to this. This one really, shows a lot. Over half of people using the Safer Supply stopped using street fentanyl. Okay, we had another 26% who decreased their use. So in total, that's 78%, over 3/4 of people on Safer Supply either completely stopped using street drugs, which is what we've just gone through, are killing people, or they reduced their use. So this is really important information, and none of it gets used. It just gets dismissed sort of out of hand. And the other point I'll mention is the BC Coroner Service, who does the toxicology reports of people, has found there is no indication that Safer Supply is contributing to drug deaths. No indication. When they do the toxicology reports, and they show, you can see the graphics, it's a whole bunch of range of drugs, but at the top of the list is that street drug, fentanyl. That's what's killing people. And the Conservative plan is to continue drug prohibition, the war on drugs, try to pretend we're being compassionate, but continue the same old story of leaving the drug supply to organized crime to provide to Canadians. And we see the results. It's the toxic drug deaths.
I want to jump onto our live chat here to give you a sense of where the audience is at. The live tuning audience this morning, Kathy reiterating to us that these conversations are extremely relevant to people. You know, for a lot of people, we're talking about their lives. We're talking about their inner circle, the people they love, the people they care about. Kathy says, my sister-in-law has been addicted to drugs for over half her life. She's lost custody of her kids. She's been in rehab more times than I can count. She's now homeless, and the kids rarely see her. It's so sad. You know, Ben says our valedictorian for our 2022 healthcare aid class, the graduating class, was a recovered drug addict who had significant help to kick the habit. And they were the highlight of our class. The reformation, so to speak, was a beautiful thing. That from Ben. Tara Lynn makes a good point. And Professor, maybe we'll wrap on this. Tara Lynn says, you know, a lot of times these conversations aren't addressing the correlation between addiction, drug use, and emotional illness, right? For many, the pain of sober reality is untenable. Trauma, PTSD, other factors. Where's the therapy? Where's the counseling? Where's the reintroduction to life? I don't have to tell you, and I know you know that my brothers worked in the downtown Eastside at Insight for many years, and it's a tough place to see. Quite frankly, Dr. East Hastings is a tough place to walk through. And quite frankly, I hate to use this word, but you couldn't blame somebody for feeling a despair or hopelessness walking through that part of Vancouver. Do you believe that this opioid crisis, with time, investment, empathy, public support, can be addressed? Is this something that can be turned around in meaningful fashion?
Yeah, absolutely. We know what the answers are. We have the evidence to show what we need to do. We need to have widespread availability of naloxone. We need safer use places like overdose prevention sites. We need a evidence-based safer supply that we monitor and assess, and if there's unintended consequences, that we put in changes to address those to the extent that we can. We need to provide rapid access to that evidence-based treatment, and we need to stop treating this as a criminal law issue, right? None of the people whose really helpful comments you just shared said, like, we need more cops in jails. There's some people saying that makes it worse. If you want to spend a lot of money and kill a lot of people, you know, send them to jail, okay? And it's your taxpayers' money, by the way. It's $116,000 a year to send someone to prison, okay? So that, and you're 50 times more likely to overdose and die if you're sent to jail. So we really can't keep doing the same, either, you know, tough on crime approach or the Liberal government's half measures, okay, the hypocrisy of that either. We need to go all in with following the evidence, and maybe, like you said, let's end on that note of compassion. You know, between when we look at people who are using substances, not everyone, but a huge proportion of them, it's trauma, and it starts as children. And people who suffer moderate levels of childhood trauma, moderate to severe, are 7 to 10 times more likely to develop a substance use disorder. And this issue, though, it goes throughout society. So yeah, you can see substance use on display in places like the downtown Eastside, and many other Canadian cities have places that are similar. What you don't see is that when I get the map from emergency responders of overdose calls in Vancouver, it's the entire city lit up, right? It is not in one little area, okay? And in fact, downtown Eastside is the safest place for people to use drugs. You're significantly more likely to survive an overdose event in the downtown Eastside because of the support that's there. Where people are dying and we never hear about is in the wealthy parts of town, the middle class parts of town. If people aren't aware of just get a picture in your mind of who's overdosing and who's dying in the community that's affected. I encourage you to go to websites like Moms Stop the Harm and hear from family members who support the types of interventions. Many of them support the types of interventions I'm talking about. They've got photos of their children. I mean, these folks look just like you and me, Ryan. And I don't know how old you are. I'm in my mid-40s. We're smack dab right in the middle of the greatest proportion of people overdosing and dying. It's actually like middle-aged men are right in the middle of that pack. Okay. And we all have different ways of, I see you got a photo up on the downtown east side. Let's talk about that. So I actually go down to the downtown east side pretty regularly, just on my own, whenever I really just kind of feel compelled to do that. I've brought my kids down there. I have young children. We went down during the last heat wave event in August when people were dying. We didn't know that deaths were happening at that point, but it's hot out. We just did a simple thing. We went to the grocery store, we bought bottles of water, and we bought popsicles and ice cream. It's a hot day. Let's hydrate people, give them some hope, okay? And that's what we did. We went around doing that. The days after the Vancouver decampment, where the city of Vancouver and the Vancouver police went in and put people's tents that they were living in into garbage trucks, we went down. And this isn't me being like, oh, look what a great guy I am, okay? I didn't have a heart to do this before, Ryan. As you know, we've talked about this. This is a change of heart for me. And it started out with seeing that I'm no better, I'm no worse than anyone else down there. Okay, 50% of people, by the way, in places like the downtown east side have things like traumatic brain injury and mental health issues. Okay, so it's often said we're all just one or two steps away from being homeless. No one plans this, and for many people, including Indigenous people who are disproportionately affected, this is the legacy of residential schools, the legacy of colonialism, the 60s scoops. So rather than look at what we're seeing in terms of the despair and the suffering, like you said, and do things like just sort of harden our hearts and say, well, yeah, let's throw them into forced treatment. We need to have some real compassion. Okay? Compassion means meeting people where they're at. It means listening to their story. And that's not what I hear coming from many politicians or these op-ed writers.
If you want to hear more about Ben Perrin's personal journey, the evolution of his perspective, you can search our podcast or our YouTube archives back on June 13th of 2022. Professor got personal, and he talked to us about his change of tune. That's Real Talk on June 13th, 2022. Ben Perrin is the author of the bestseller, shortlisted for a number of literary awards, Overdose, Heartbreak and Hope in Canada's Opioid Crisis. He's Stephen Harper's former Justice and Public Safety Advisor and a professor at UBC's Peter Allard School of Law. Thanks for your time and your perspective. We always appreciate it.
Thank you, Ryan.
This week, for 3 days in a row, we've honed in on 3 different perspectives on Canada's opioid crisis, including on safer supply. It was journalist Adam Zivo and his piece in the National Post that got a whole bunch of you riled up on Monday. Yesterday, it was Professor Ben Perrin, Stephen Harper's former justice advisor, who joined us. And in just a moment, we're going to talk to Guy Felicella and Dr. Andrea Sereda. They have lived experience in different applications on harm reduction, addressing the opioid crisis in Canada. But first, we wanted to play some video, a development yesterday in the House of Commons, where our guest on Real Talk that day, Ben Perrin, saw his name invoked in an exchange between the leader of the official opposition, Pierre Poilievre, and the Minister for Mental Health and Addictions, Carolyn Bennett. Here's how it went down.
From the top, please. Order.
While the Prime Minister has sent inflation for gas, heat, and groceries soaring, there is one product that's actually come down in price. Powerful opioids. The Prime Minister has spent $100 million on so-called safe supply. One Global News reporter went into the street to find out where all these drugs are going. Turns out they're being resold to other addicts in order to raise the money to buy deadly fentanyl. Will the Prime Minister cancel the dollars for drugs and instead put the resources into treatment for addicts?
The Honourable Minister for Mental Health.
Mr. Speaker, we are pretty fed up with this fight against evidence-based programs that actually are saving lives. We cannot allow the Conservatives to take us back to the failed ideology apology of the past. Even Harper's advisor, Ben Perrin, thinks they're speaking nonsense. So just stop it and save lives.
The Honourable Leader of the Opposition.
Yeah, look at that. You can tell that that's something that the minister feels strongly about. Dr. Andrea Sereda is a family physician in London, Ontario, at the Intercommunity Health Centre. If you read her Twitter bio, you will see that she is a safer supply prescriber, and we're going to learn more about that. Guy Felicella spent nearly 20 years residing on the street in Vancouver's notorious downtown Eastside. He experienced multiple life-threatening infections, 6 drug overdoses. He's recovered with more than a decade of sobriety under his belt. He is now passionate about advocating for the vulnerable, and he is a highly sought-after international public speaker. It's a real honor and pleasure to welcome the both of you to the show. Doctor, can we start with you? Was there a feeling invoked in you when you see that exchange in the House of Commons yesterday? It's not always that passionate.
First off, I hope I can be as fierce as Dr. Bennett when I grew up and be like her. So it was really validating to see her stand up for the evidence in the House of Commons yesterday, because I think that's what's being lost in all of this is a focus on the evidence, and the evidence refutes all of the claims from the Conservatives.
Guy, you're a success story. And not everybody who is a success story in the context of addiction, quite frankly, or opioid addiction in particular, wants to talk about it in front of thousands of people all the time. But that's exactly what you do. Can you give our audience a sense of how dramatic your turnaround was more than 10 years ago?
Well, I mean, yeah, it's a miracle. Medical science would suggest that I shouldn't be here, but it really goes to the reflection of the evidence and the policies that, harm reduction really kind of, allowed me to get to this point. And without it, I wouldn't be here. I wouldn't have over a decade sober. My children wouldn't be alive. The life that I have today, trying to, inspire others that we have to, end the division between both sides and come together to support people, whether they have an addiction or not. And, unfortunately, it's political opportunism that's changing things. And, both sides shouldn't be about that. That turns into, sadly, I've seen it happen with the HIV crisis. There's just a lot of death that'll happen because of it. And so, we have to figure out that bridge these gaps together to support both. I'm all for supporting people who use drugs, and I'm all for people who struggle with an addiction to go into treatment and recovery services as well. So that's just, what I'll keep pushing. And, I believe in it because it worked for me, and I've watched it work for countless others.
Doctor, we spoke with Adam Zivo on Monday about his piece in the National Post. It describes it as a drug fail. He asserts the Liberal government's safer supply is fueling a new opioid crisis. You prescribe so-called safer supply. Can you explain to us how you got to that point, your conviction as a health professional, that this was the appropriate or evidence-based way to do this, that this was the right way to do this?
Absolutely. And so I work in London, Ontario at the London Intercommunity Health Centre. And we have the largest and longest running take-home safe supply program in Canada. We started way back in 2016. And, in 2016, I did not know the word safe supply or the word safe supply. But what I was seeing is since fentanyl, came onto the streets of London, Ontario in 2014, 2015, I was seeing people die. My patients were dying, or my community was dying, and the traditional, addiction medicine interventions that I had at my disposal, they weren't working to keep people alive. And so, again, not knowing that safer supply was a thing or a term at that time, we made a leap. We made a medical and moral leap, and decided to prescribe clean medication, clean opioid drugs to people who are using the fentanyl street supply. And we started off very slow and very cautiously, initially with just 3 patients who were always having overdoses, were, at critical junctures in their own health. And again, our original, objective was to keep them away from the fentanyl supply, but we felt like we saw magical improvements in their lives. They had no more overdoses, no more emerge visits. Their HIV became treated. Their mental health was treated. These aren't things that we were necessarily expecting in that first group of patients, but we saw it happen, and we saw it happen quickly. And so with those initial successes, we slowly expanded the program until here we are in 2023, and we have approximately 270 people on Safer Supply in London, Ontario. We have a wealth of published evidence, which shows the benefits for Safer Supply, the benefits in reducing overdose, decreasing infectious complications. We see those go down by 50%. Decrease in, involvement in criminalized survival activities and survival sex trade, decreased hospital admissions, decreased emerge visits, improved mental health. All of our data is pointing in resoundingly positive directions for people who are accessing a safer supply.
Guy, it's so powerful to hear someone like you say harm reduction saved my life. Like, I mean, it's a black and white thing. Like, if it weren't for that, you would not be here. Your kids wouldn't have a dad, or your kids wouldn't be here. I mean, we're talking life and death. I really appreciate you talking about, the political opportunism angle of this, because we know how it plays. We know it's sensational. And we talk about how it's been torqued. And I wouldn't necessarily say equally, but I'll say on both sides, right? Number one, the Liberals or the NDP want to give you free drugs. They want to flood the streets with free heroin. And then on the flip side, the Conservatives don't care if you die. And it kind of gets into this really unproductive back and forth where everybody's basically calling the other person a heartless, soulless ghoul. What do you tell people when you encounter someone that maybe doesn't even know the details of your background? And they say, well, this Safer Supply initiative, this is just flooding the streets with free drugs. Can you take us into how you might respond?
Yeah, I mean, I just, let people know that you have to understand the people that you're working with first before you start just pointing fingers at what they're using or what they're doing. And when you know somebody or get to build a relationship with somebody and you see the immense amount of struggles that people have in their lives, and then you see, people getting on, whether it's OAT or Suboxone or Dilaudid or an IL program. And then you all of a sudden see the other social determinants of health start getting addressed, like your health and wellness, your mental health, the ability to go fill out a housing application or get access to housing. And you start to see these things. Then you start to see the ability for somebody to go and work, get on an outreach team and start to do the same things that, that I started off doing, and so it's really, when you actually look at it, what the reality is that, we've just created this division on both sides. So, and until that piece changes, people are going to die. And guess what? Going into addiction treatment took me over a dozen times. And when you actually think about it, that doesn't guarantee that you're going to be sober either. So there's a lot that goes into, treatment and recovery as well. And when you go through a 3-month program, which I did, 6-month program, 9-month program, multiple times, and still hell bent on once I'm released, finished the program, I go back and I use again. Sadly, in this day and age, that means people die. And so for me, I can't understand why people in recovery wouldn't support an avenue for people to access safer substances, because I'm always about giving people the opportunity, let them try again. And a lot of people are trying. I don't think people reflect that in today's day and age, just because we don't get the outcome on, what people call successful, as in, abstinence. That part has to change, because I will tell you, I just work with people. To me, I don't care if they use drugs or not. And if they struggle with an addiction, I get them into treatment all the time. And the one thing in treatment, it's a real challenge. And the first step is it's really hard. But once somebody gets rolling through it, the success that happens, even if you go back to using drugs, I always tell people, don't beat yourself up. We can try again. Let's get you into this, harm reduction program where you can access safer substances. Try to remove you as much as possible from the illicit market, because that's what's truly killing people. So I'm just, try to explain that to them. And guess what? Like, even my father-in-law, who votes conservative, he was against harm reduction, but realized that his grandkids wouldn't be alive today. And it completely changed his views. And sadly, that's what often has to happen in our society, is that people have to experience something close or near to them before they start to change. And it shouldn't really, I wish it wasn't so, but sadly it is.
Doctor, what do you see, in the context of your colleagues? Is there consensus in the medical community, as far as you can tell, that this evidence-based harm reduction approach is the right one? Or do you find that there's even necessary advocacy amongst your colleagues and your fellow professionals to convince people that this is, what you believe to be the right way?
No, there is not consensus, and I think the National Post article really highlights that. Right, it's safer supply. Although we've been doing it for 7 years, it's a new approach. It's an innovative approach. It's quite different from approaches that came before it, and so critical physicians should question how we are doing this. They should ask us for data. They should critically examine our data and our evidence to come to their own conclusions. And I would say, physicians and other clinicians who have done that, who have read the evidence, or who may have seen a patient dramatically improve in hospital or in community on safer supply, there is consensus among those physicians. However, we're really seeing this pushback, and largely in the addiction medicine community, the medical addiction medicine community, with people who are not reading the evidence or acknowledging the evidence, and are really pushing back against safer supply with anecdotes that have no data to support them. And my concern there is that those arguments are being, compared as equal or treated as equal. So the critical side that was interviewed in the National Post, we have repeatedly asked them to engage with us and show their data and evidence around their claims around the harms of safe supply. Because as a program and as a safer supply community, if it's causing harms, we want to know so that we can address them and do our very best to prevent all harms, not just to individual patients, but to the community as well. And so we've tried really hard to engage with those folks. We have not received that collaboration back to us. We have not received any data or evidence to support the claims that they're making in a very public fashion. So in that manner, unfortunately, there is no consensus. But I do feel that the medical community is divided on those who are willing to read and interpret the evidence, and those who are really focused on ideology.
Guy, when you say harm reduction saved your life, can we get specific? Can we talk about some of the things that worked for you, some of the resources that were there? And 7 years ago, so I'm trying to do the math, the program wouldn't have been available, the Safer Supply program, to you. What was it that worked, and what was it that ultimately changed or saved your life?
Well, in the sense, the wording of safer supply that exists today really existed back then. It was just the essential of a doctor willing to give it to you.
Okay.
And so, that happened. They couldn't keep me in a hospital with osteomyelitis bone infections. And so they created a program in the downtown Eastside, which is a community transition team, which was run by nurses and doctors, where you could actually use substances. You just had to be there to get your antibiotics every 4 hours. For 24 hours a day for like 8 weeks. This is just so that I don't die. And I remember the doctor saying to me, listen, Guy, how do I get you to come here to stay here? You live there, and how do I get you to be here every 4 hours? And I said, I can't be in withdrawal. And so I was given, morphine, dilaudid, hydromorphone back then, to actually go through the treatment plan. And it worked brilliant. And here was a doctor that balanced his medical practice with a harm reduction practice, because he realized, Guy's going to die if I don't do something. And so that was more important to him. And I'm still in contact with that doctor today. Also in the harm reduction front, which obviously I'm very passionate about, is the supervised consumption sites that people can access. Being brought back to life there multiple times, and witnessing the humanity and compassion of people who didn't judge me for you. I was already judging myself for how I was living. Believe me, I didn't need to be piled on from anybody else. I was struggling inside. And that moment where, it took so long to get me back. They actually were crying because they didn't think I was coming back. And when I saw that nurse with tears, my first response to her was just, why are you crying? And when she just said, Guy, I care about you, I just lost it and started breaking down. And at that moment, I knew that I had to do something different. And so really, harm reduction was the catapult into the recovery that I have today. And it blended in beautifully because they weren't telling me every time I walked in, like, hey, you got to go to treatment, you got to do this. They just welcomed me in there and knew that, that I was struggling as a human being already. And they were there to support me. And that support really kind of made me believe. It gave me hope. And that hope turned into, a vision. And I had a belief. And I was always trying. I can't state the facts enough that people are trying. And I was always trying. I didn't get the outcome that I was looking for either. But I just kept persevering and trying and until it was finally successful. And sadly, in today's day and age, if we don't have that harm reduction safety net in our society, people will die. And that's the part that I just try to explain to people. It's like, look, we can disagree on a bunch of different things. But what we can't disagree on is that we have to, do what's right for the person in their circumstance. And that means just keep them alive, whatever means possible, because we just can't let somebody not have an opportunity.
Doctor, I'm not sure how closely you're following Alberta politics from Ontario, but there's been some interesting developments over the past number of years. Some supervised consumption services that were open and operating, including the city of Lethbridge, were defunded. Some of them that were slated to open lost their funding and didn't open. Well, at the same time, the Conservative government at that time, under then Premier Jason Kenney, had committed millions of dollars to essentially detox programs. So they were moving the money around away from supervised consumption towards detox and saying, essentially ideologically, we believe that this is the way to do it. We acknowledge this is a problem, but we think this is the way to go. This manifestation of the Conservative Party under leader Danielle Smith is taking it a step further. I'm not sure if you noticed, but a couple of days ago, she promised to allow what's being described as mandatory drug treatment. In other words, if a police officer or a family member or a health professional believes that someone who's using drugs needs to be put into detox, I'm putting it casually, obviously, that person could, against their will, be admitted to a detox program. What's your assessment of I don't know how I put this without being so cynical, but I mean, Guy, your body language is saying it all. We'll come to you after the doctor. What's your assessment of this plan, Doctor?
I do follow Alberta politics and policy around this, and it keeps me up at night. Certainly, if first I'll answer your questions around the removal of harm reduction services in Alberta. We know that it's causing people to die. In the fentanyl era, detox alone kills people. Detox is very rarely successful, and Guy can certainly speak to this more than I can. Less than 10% of the time do people remain abstinent from drugs. So what we do when we put people who are dependent on the fentanyl street supply into detox is we put them into forced abstinence and forced withdrawal. And typically detox is a week or two at best, and then maybe people move on to residential treatment. So in that time, what we've done is we have removed people's tolerance to fentanyl. So we've removed their tolerance to fentanyl, but we have changed nothing about the circumstances of their life. They're still housing deprived. They're still living in violent relationships. They still have all of these things going on. And so we remove their fentanyl tolerance and we send them back out into their lives. And what happens at that point is people overdose and die. because they use the dose that they were typically accustomed to, and it's far too much because we've taken away their tolerance. And we see this all the time in different scenarios. When people are coming out of incarceration, we see these deaths. We see people coming out of hospital who lost their opioid tolerance in hospital and return to their previous fentanyl doses, and they die. So Alberta's really creating a situation that will lead to more deaths, not less deaths. And that goes along with the removal of supervised consumption services. Alberta has also had a large political push against safer supply. They've actually rebranded it as the Public Supply of Addictive Drugs, or PSAD. And I think that really frames the ideology around how they're approaching this issue. They're approaching it as a moral issue. They're labeling addiction. And what should also be noted is a lot of the physicians who were interviewed in the National Post article also shared their anecdotes with the special committee that led to the Public Supply of Addictive Drugs approach. And so those same anecdotes that I mentioned that have no data, no scientific evidence to support them, are now guiding provincial policy. And that provincial policy is leading to death. I did see the article around involuntary treatment. And like I said, it kept me up at night. Separate from just the medical implications of it, which I've explained around tolerance, if we're saying that anyone in the community, family member, anyone else can apply to have someone essentially incarcerated against their will and forced into a treatment that they do not consent to, what world are we living in where that is true? Who gets to decide who needs to be forced into treatment? Who gets to decide when they need to come out? Who decides when they're well enough? Do they have to meet only certain criteria of wellness to be released from this medical incarceration? I cannot see this going in any way other than a violation of people's human rights and real harm to the community of people who use drugs. And it's really weaponizing an approach to care.
Guy, how do you think that would have worked out? 15, 20 years ago, had a police officer that knew you by name on the downtown Eastside, put you in the back of the car and taken you to treatment. How would that have worked out?
I wouldn't. I mean, the optics of it, right? Like to hear we're going to help people get into treatment. It sounds good publicly, and politically, I'm sure it's palatable for a lot of society. But the forcing part, it's like, recovery is about attraction. You're either attracted to what somebody has, and that's what attracts you to be like, wow, I want to try that. I'm looking for that, right? And if you start forcing people into an environment that they not ready for, don't want to be in, how does that actually work with the people that are trying to be there, right? It's like you're going to create a prison industry environment inside the treatment models, which will make it completely, it'll just turn into, and honestly, I mean, it's like trying to privatize treatment in a sense where it's almost like turning it into an institution. And I don't know, any substance user out there or any person struggling with addiction, being institutionalized is terrible. It's not therapeutic. It's not life-changing. It's not supportive. And just the way that going in through treatment as well doesn't guarantee that people will remain sober after. And so I honestly, if everybody could just go into treatment one time and get out and never use drugs again, hey, I'd say, okay, well, here we go. We got it. Let's just do that. But this is not the reality. And so, I get it, family members that witness people struggling with addiction and they're like, their hands are up in the air. They're struggling. They're tired. They're I agree. They're living a hard life. As well. But the one thing is that oftentimes I talk to parents a lot. I just say, listen, let me just keep trying to work with this individual. And this is really how recovery worked for me. Is that I saw some guy in the downtown East Side that I thought was impossible for this guy to ever get sober. And one day he showed up and he was sober, handing out coffee and sandwiches to people. And it blew me. That's what attracted me to start looking at that. And if we go with an attraction rather than trying to promote something that's against people's will, it'll sadly, the implications are disastrous for people who use drugs again. And, that's the part that worries me the most.
Guy, you tweeted just yesterday, I mentioned when we introduced you that you speak publicly and to different ages and different sizes of groups, all over the place. You tweeted yesterday you were at a school. Looked to me like you were speaking to hundreds of kids. I would imagine you spoke for like an hour, so I'm not asking you to go through it all, but what's your main message to when you have a young and captive audience, but this is an audience, we've all been there. We're in our teenage years into our 20s. We're curious about things. Some people are dealing with trauma. There are a lot of reasons why people wind up where they wind up, and sometimes despite hearing the most powerful testimony from people with lived experience. But what's your key message? What's the main thing that you convey in speeches like the one yesterday?
Multiple approaches, ending stigma, harm reduction, recovery treatment, anxiety, depression, overcoming the obstacles. People always remember how you made them feel, being kind. Human connection is a big one. And, and the reality is that, we do need support in order to face the challenges together that we have as people. And I'll tell you, out of every talk that I do, and this was a talk over 600 kids, there is a lineup of kids who have been impacted by stigma, treated poorly because some do use substances and hide it. Some are going through withdrawal. Some have parents that have overdosed and died. One of the most gut-wrenching, sad, where I was talking about that drug users aren't bad people. We just often have challenging circumstances. I had a 16-year-old boy come up to me, and he was so thankful. He says, my dad died of a drug overdose in 2020, and I don't share that with people because of how people view it. But I want you to know that what you said really made me feel good. And he said, my dad loved me. I know he had a challenging life, but he still was my dad, and he still did his best. How do you understand that we are passing this kind of language of stigmatization and discrimination against people who are struggling into the generation in the rearview mirror? I just hug this kid. And so in a lot of my talks, it's a lot of handshakes, a lot of hugs, a lot of emotions, and a lot of people who just never gave up in believing in Guy. And, my alias on the street, I always say this to kids, because my alias was Tony. Everybody in the downtown Eastside knows me as Tony. They won't call me Guy. And I don't even correct them anymore. But I remember one kid asked me, why did you go by the name Tony? And I said, because it was too painful to go by Guy. And now I'm okay with being Guy. And I'll continue to fight for the rest of my life for all those kids, all the lives lost, all the people struggling. I won't give up. And I will try to counterbalance misinformation constantly. It's what I'm driven to do. And my experiences in life have really put me in a position, to give people a balanced approach, that we need everything. And I don't dispute the recovery industry could be a heck of a lot better across Canada. 100%. I want that for people. I want people to get immediate access when they want to access it. And I want people who are using substances to have immediate access to safer substances. I want it both. And if we can do that, I'm telling you, we will save a boatload of lives and change the direction in the future so that we don't leave this behind for our kids, your kids, and other people's kids, because this isn't going to go away.
Not even close. I so appreciate that, Guy. Thank you so much. Before we thank both of you for your time, Doctor, we should note that you're presenting on a webinar coming up in just a few minutes, so we've got to let you go. Everybody wants to hear about your expertise on this and other subject matter, but I want to make sure that we don't leave anything on the table. I want to make sure that we've touched on everything that you believe to be important or relevant to this debate. It's something that Canadians can't ignore. We had the mayor of Edmonton sitting in this studio beside me just a few days ago pointing out that, 2 people in Edmonton, just in this city, 2 people are dying every single day from drug poisoning, from overdose. It's something that we cannot ignore and must not ignore. Doctor, what's something that maybe we haven't touched on, but something that you think is extremely important for people to keep in mind as they not just form their opinions on this, but perhaps action, as they decide how they're going to feel about this and what they're going to maybe do about it?
Yes, and thank you for giving me this last opportunity to speak. I think I would like your viewers, your listeners, all Canadians to remember that we have over 35,000 people dead to this crisis since the beginning of it. 35,000. Overdose is now the leading cause of death in men under the age of 40. We lost 42,000 people in World War II.
Huh.
We're at 35,000 dead from this crisis. We have monuments to World War II across the country, as we should. So think of those lists of names. If you approach those monuments, the names are engraved, they're tiny, and there are so many of them. And we have almost as many names who are now dead to this crisis. There's enough work for all of us. We need to collaborate. We need to provide a full spectrum of solutions, from abstinence to rehab to methadone to Suboxone to safe supply. We need everything. We need this full court press from all clinicians, all community members taking care of people who use drugs, to prevent that 35,000 from becoming 42,000, 60,000, 100,000. So thank you.
So very well said. Guy, my man, last word to you.
Be kind, everybody. People remember how you made them feel. That's really the essential thing of life to transform somebody's life. Just sit down and, be kind to each other and take care of each other, because we're in challenging times, and don't let the politics sway you either way. Look at the person and the people, and, do what you can to do your best by them. And that's really what it's all about. It's not rocket science here.
I was going to say, isn't it amazing that the lessons that they teach us in kindergarten sometimes often still apply when we're grown-ass adults. That's Guy Felicella and Dr. Andrea Sereda, both incredible human beings. I encourage you to give them both a follow on Twitter and to let them know what you thought about this interview. Thanks to both of you for your time. We really appreciate it.
Thanks for having me.
Thanks for having us. Have a good day, guys.
You as well, Guy. Thanks a lot. Powerful stuff. It's really powerful stuff. You look at the death toll of World War II. You look at the opioid crisis in Canada. When Guy talks about this as people are going to die if we don't do this, you wonder why more people don't have a fire lit under them when it comes to the conviction of it. But he's right. And you know this too. The politics of this have almost taken over. In any other healthcare scenario, we look to evidence-based approaches and we adopt them, right? Like, what did we do throughout COVID? We understood as best we could what it would take to stop the spread, and everybody bought in. For the most part, people that are diagnosed with cancer will consult with their oncologist and ask, what is the best evidence-based approach to fighting this cancer? With any diagnosis, that's how we approach it. With any health issue or epidemic, that's how we go at it. But for some reason, this one, it's not that way. Maybe it's time that we invite the politicians to take a back seat while the rest of us decide the best way that society needs to move forward on this, and use our influence, including with our vote, to send a very clear message to lawmakers on what our priorities are. I received an incredible message from an audience member who I'm going to keep anonymous, but they wrote in this after our conversation yesterday with Professor Perrin. They said, I just wanted to say thanks for that great interview with Ben. He offered a sophisticated and passionate rebuttal of Adam's Evo, which I also listened to, this audience member says, though it was very policy focused. It was also very emotional for me, says this viewer, and I would imagine many Albertans, says our daughter has struggled with addiction. In her case, alcohol, not drugs. She's now almost 2 years sober and recently celebrated her 28th birthday, but there was a time when we never thought she would hit 30. We'll call her Lindsay, is now working as an addiction peer counselor and pursuing further education in the field. And Ben Perrin was exactly right that drugs or alcohol are the focus, but the root cause is trauma. Disproportionately Indigenous representation, too many survivors of sexual and physical abuse. Lindsay had the benefits of a stable family with financial resources, but it still took many, many attempts at treatment, at rehab, and COVID sure didn't help before it finally clicked. And even now, it really is one day at a time. This audience member says, so what about those without those forms of family support? Just wanted to let you know how much we appreciate those conversations on Real Talk. They truly do affect people's lives. We appreciate those of you that take the time to let us know how these interviews resonate with you and to let us know what other subject matter you'd like us to take on the show. You can send us an email anytime to talk@ryanjesperson.com.